That is a very good question, and it is a very difficult question to answer because I could go on for a very long time. Several factors really that we look at, and several matching criteria that we look at. First, we have to make sure that the size matches. So the organ that we are transplanting will match the recipient, because if it's too small, it's not going to be able to supply the body is blood needs, or if it's too big, we won't be able to feed the heart in. So that's one of the probably the number one problems that I am always facing. Second, we look at always the distance, again, which I showed you on the map, how far we have to go to retrieve the organ, because that can be prohibitive. We also look at immunology, for example. So sometimes recipients get blood transfusions or other reasons. Infections, for example, can have antibodies. That means there's certain potential donors whom they cannot accept organs from, otherwise they would reject immediately. So immunology, for example, is another such factor. One question that comes up: do we have to look at blood group? That is less important. So the blood group is not very much needed to be matched for heart transplantation specifically, because that will not affect rejection. Of course, we also look at donor recipient age and so on. So there's many factors that we look at and try to match as closely as possible. Sometimes we are limited depending on how sick the potential recipient is, but that's a critical, actually, that's a very important point for the transplantation process.